Okay, so first of all, before my client come in, I'll check myself how I look like. Do I look any dirty? Do I look any spots? Do my fingernails is something stuck? I check my teeth, everything. I smell myself. It's like I said, it's important because if your hygiene is low, and customers will see that, it's not good. If your station is not clean, if your sheets is dirty, because I see a lot of places you go and people just use the sheets twice. For me, it's just like, phew, I'm stop the session. I say cancel my money, refund my money, and I get the hell out of here. And I see a lot of places in Los Angeles area, they use this paper. They just rip the paper and basically you lay down on the paper. In a lot of places, those for $40, you can lay down and you can see other people lay down on the table. So it's no privacy, it's nothing up there. So, like I said, hygiene, station is clean. Make sure it's nothing on the floor. Now my client is come in. It's the first time. He don't know nothing about me. I don't know nothing about him, and this is the key to learn more about my client, understand he needs, and explain who I am and how I can help him. If you don't do that, if you just like, hey, hi, lay down, bye bye, that's not gonna work. It's just waste of. If you do invest money in marketing and advertising, it's just a waste of money. If your customer come in, you have to grab that guy and never let it go. And if he's not calling you back, like call him and what's the call? Um, how you call that? Aggressively tell him to book massage. No, I'm just kidding. Don't do that. All right. So David come in first time. Let's say I meet him at the lobby. I bring to the room and explain. Hi, my name is Jay. You're going to be your therapist. And David, how I can help you? What's your goal for the therapy?
My neck has been hurting me, and when I turn to the left, it bothers my neck right up.
Okay. And it's like right in here, you feel it all the time. So this is called I forgot what's the name of this listening. So it's kind of active listening. So you all inside the customer pain, you inside the customer story. You never interrupt. You don't ask question till he finish it. So he finish it. I'm gonna ask next questions, and you guys know all those 10 questions. How you've been injured, of like when is onset of the pain, what type of pain, is any movements hurt. Okay, let's go ahead and do it. So David, can you tell me when this pain is started?
It started about a week ago.
Week ago, okay. Did you done any specific motion? You did anything?
I was vacuuming under my bed, and I
Uh-huh.
realized that my neck was in a weird position,
Okay.
and then it started after that.
Can you, okay, so I usually ask, yeah, like, can you show me exactly what he's already did? He said, I'm kind of bend and pull that shoulder. So it's give me idea, the shoulder being active, the neck is being bending, and that's already give me the key to search what's going on with this. So next one, is that happen first time or is that happen like often? Maybe twice a year, once a year?
It doesn't happen very often, maybe twice a year or something like that.
I see. Do you feel any tingling, any numbness in your hand? Because I want to ask if that's related with nerve connection. If you feel tingling, numbness, if it's like pain, it's always need to be careful. So
No, I don't have any radiating pain or
no radiating pain. Okay.
my hand's strong and there's no weakness.
Okay, it's a good to know if weakness people sometimes they can't even grab. So I usually give them like to squeeze something and see how they react on that. Can you describe the pain? Is it sharp? Is it dull pain?
It's dull.
Dull. Okay. And any particular movements it's make you. Today is actually a case study the neck, so we're gonna work on the neck. Is any particular motion is cause the pain? Maybe like rotation or like when you tuck your chin or you look up.
Mostly when I turn to the left.
So when he turned to the left, he experienced that pain. So this is already tell me we're gonna do those functional movement tests later. Yeah. So I ask the questions. Is anything relief the pain? Like you put some heat or stretch?
If I rest it for a while,
Uh huh.
like in the morning, it's fine, and then as during the day goes on, it starts to bother me more and more.
Perfect. So my first step is being ask everything about client. Now I have a couple minutes to talk about myself and introduce how I can help. Okay, so I asked all those questions. So David, I'm usually I've been therapist for 20 years. My mission is to find out what's the cause of this pain, and I would like to focus specifically on this area. If you like thinking about full body massage, we can able to do that, but it's maybe not correcting that problem. I mean, we have to create that treatment. We have to just get this, see how long it's going to take us to get away and feel you better and start moving your neck without the pain. So are you okay with that
Sure.
to focus on this area? So
Yeah.
I'm explain. I would like to just focus on that problem, and a lot of people they thinking you can do the problem and plus just full body because that's how people is. If they think you do full body massage, it's always going to be like beneficial for them. If person come in with the pain, I always focus on that pain and want to find out what's this pain, because if I correct it, if I'm going to help him at least like a 10-15%, he's going to be feel much better. Guess what? It's big percent possibility to David come back to me and get better and better and better. So I'm explain that part. Next one, I'm going to explain him about safety. So I'm always work draped and dressed. If you don't want to be dressed, you still need to lay down between sheets and cover yourself. Okay. If any pain present during our session, I want you to always notify me. Always let me know it's a pain present. I don't want you feel any pain because I believe if you during the session if you experience pain, it's something we're not doing something right. We don't want you to get more stress, get some more like a block yourself, and that's what I'm telling. Also talk about pressure communications and any preferences on therapy. Maybe the clients have something in mind, maybe he go to the other sessions, and any particular style of therapy maybe or
I like deep tissues.
yeah, you see, it's good to know because if person asks me about deep tissue and but I'm doing more fascial release, I believe more fascial release is going to help me, help him. But I'm still doing like your, as you know, more fascial release. It's a light stuff. But person like that deep pressure, I will give it to him. I will do my work, but I still gonna give him after maybe some deep pressure because person like it. I want to make my client happy and healthier, right? So that's the mission. Okay, so next one, I do range of motion. So I see a postural assessment. Sorry, this is the next one. I want to see how David it look like. So what I'm doing up here, let me get this table away. And what I want to look on the David, I want to look at the postural, and I'm always look at the all the way from the toes to the bottom. But it's the neck, like I said, it's just a practice class. I'm usually look at the ankles, knee. I look at the hips. I look at the shoulder position. I look at the eye position. How the head. Maybe the head is tilted this way. Maybe it's a anterior tilt head. So as you can see, I look at this. You can find out in our book, assessment book. We get a lot of cool information up there, and learn this is great for massage therapists, personal trainers, coaches, a lot of cool stuff. You can truly help your client. So I see it and I'm explaining the David. So he got the shoulders high, the right shoulder is high, the head is tilted to the side. The hips is probably uneven. The ankle I see is not even. So it's a lot of things to explain. I don't want to overload my clients. I'm just gonna say, oh, I see this shoulder is a little bit high and your head is a little bit tilted. What do you do for a living?
I do manual therapy.
Yeah, wrong answer. He's a computer guy. So
Computer computer programming.
computer programming guy. That's what we most of the time have it. So and I'm usually do some radial motion. So I asked my client, turn the head, see how's everything going. Let's pretend, yeah, go ahead and turn. That's not for the camera. You do for the camera, it's fine. So go ahead and turn. You see, and this is limited. You guys, like I said, it's everything in the book. We're not gonna just talk about this. Go ahead to the right. You see, it's much better. I ask him how you feel. Is any pain present all the time? I always ask that. It's any motion cause the pain. Now I want to test that shoulders. I want to test that shoulder mobility. So yeah, place that, raise it up. Is any pain present? Switch it. Yeah. I want to do this thoracic mobility and shoulder mobility. I want to squeeze the thumbs like this and go as far as possible here. You see that distance and switch. Look at that distance. It's already telling me, so shoulder is not working. I'm going to do radial motion on the table. I'm going to ask him to do external, internal rotation of the shoulder, extension of the shoulder, and that's my mission. So after I find everything out, I pointing out, so he's already know if this was painful or like any test been painful, my mission to improve that and end of the session, at least, like I said, if your client feel 20% less pain, this is my goal. And that's a lot of percentage. My clients come back and stay with me. So next one, I'm explaining how to lay down, how to be dressed. Like I said, we already did this. Next one, I'm going to do the session. So my client is lay down. I'm always ask about pressure. Let's just demonstrate that. Why not? So during the session, go ahead, just lay down with the shoes. No, face down. There's just face down. Whatever. He's lay down, face up. You don't need to undress. Oh, okay. Okay, he's not undressing. Yeah, with the shoes, with everything. Yeah. So let's say, like I said, I'm doing my first movements. I want to calm my clients down. A lot of people come in with a parasympathetic system, not a problem, overload. People in stress, and some people not relax. And what the massage therapists do, first movements, they start digging that elbow, like they get that elbow, or they get this rounded back. They see it and they start doing this, like, oh, and I see it a lot. Almost every time people just get those elbow and they think they're gonna just release that tension with this high pressure. No, the most problem if the person overload with a parasympathetic system, nerve system, he's not going to be relaxed. He's going to be constantly contract, and it's a lot of people like that. If somatic nerve system overload, it's going to be hell. But most people live in stress, especially right now with all this things happen in the world. People stress. They come in, like you can see the lips, you can see the eyes. I always do some eye testing too to relax my customer. I do saccadic vision to calm my client down. I ask my client breathe. I want him to lay down, and I see how he's breathing. This is my first thing. I want to see how that ribs is rising. Yes. And I start doing a little bit rocking. I calm my client down. I do a little bit like decompression. I maybe like rib springing. Here we go. He just pop, very gently pop. So I don't do any crazy stuff, okay? And of course, I'm going to start doing my treatment. I start doing neck work, shoulders. This is not the position for the neck, for sure. I'm always asked about my pressure. How's my pressure, David? How do you feel? If I ask him to move, if I ask him to do something, one thing, I'm just showing it to you what people do. I saw that a couple days ago on some channel. The person tried to mobilize that hip, and what people do, they actually, you will see what I'm trying to say here. Always ask about if any pain present. If I'm gonna grab, I see people doing this. So they grab that knee and they bring this leg up. I saw that. Look at that. You dump that pelvis down. You create more lower back pain. You can create that really, you can injure that person, and you start doing that. And I see a lot. I see a lot. People come in for the hiring. They do this thing like hip, whatever that extension of the hip. Not good. You always want to lock it in. And if I do that kind of stuff, I bring it to the first restricted barrier, and I always ask the client, how's that feel, David? Feels good, feels okay. I'm not going to push down. Now I'm explaining my David what he's have to do. David, now you're going to push it down towards the table. And I let them know if person doing something not, you just show it to him. You just show with your movements. You see, I lock it in and let it go, relax. I always guide my clients. Without guiding your client, if you do something like this and he don't know, he's in pain, what's going to happen to him? He will never come back to you because he got this lower back pain. He might have a disc problem, and you extend it and you didn't ask anything. It's like, okay, and you just drop. The client already not happy. He will never gonna tell you about this. Maybe he think it's okay because he don't know what the therapy is. He feels some stretch. He feels some pain. Most people, when they experience pain, they think it's good. And I'm telling you, as a massage therapist for 20 years, if your client experience pain during massage, you're doing something wrong. You're not supposed to do that. And because the brain lock everything in like security, you're not going to relax. You're going to be create more anxiety and more stress in this person. And you not get that relaxation effect. Okay. After I'm done my session, I usually tell the clients what's going to happen next. I usually want to talk private inside the room. So I'm going to step outside. I'm going to go grab some glass of water for my client and go wash my hands. So I tell my client next, okay, David, so we all set. Okay, how do you feel? He feel relaxed, even if we don't do anything, but he's still relaxed. You see, people in the table already relax. And I'm going to leave this room, David, right now. I ask you to get up super slowly, take your time, no rush, get dressed super slow. And when you be ready, go ahead and open the door. Only one thing, do not put your shoes on, okay? Because I want to do reassessment and retesting. I want to show my clients how beneficial I was. Was beneficial or not beneficial? And that's the key, okay? So let's say I step outside. David is get ready. He's a little bit open door from you, okay, David, when you be done? So let me know you're ready. So he's going to open the door a little bit. Let's say it's happened already, okay? You need to get up, David, now. He's like, what the hell? All right, so here we go. David, I come back with a glass of water, give him the water. Okay, here we go. So, David, how do you feel?
That's much better.
You see, he's like, start doing this stuff. That's people doing this right away. I always like, no, calm down, slow down, because we don't know how, like, the problem, like the damage. So I want you to slow down, okay? And what I'm doing, I do reassessment. I look at this head positioning. I look at the shoulder. I look at the hips if I work on the hips. And it's telling me it's good. So I see the more balance, and that's the idea. Now I do range of motion. Go ahead, turn your head. And in this case, so now watch. He's turning when the pain was there. He turned like, and it was 20 degrees. It was pain, right? So now he's turning, and he turned a little bit better. And I'm like, wow, that's really bit much better. That's really, we need to work on your neck, my friend. We need to check Yana. You see Yana, if Yana worse, we're going to work on Yana. If David, this is like, this is bad. This is not turning. So my idea is to let the client know the range of motion better, the pain of level down. And if not, that's okay. It's okay to do to change the technique, or maybe do some other, maybe acupressure points or some exercise, show them homework and see if this is going to work. So my mission is right now to prove the clients I've been very beneficial for him and everything is well, great. So now we need to create that long-term relationship. I'm not going to sell him package right now, like, hey, buy the package, right? I have this package. He's already good. I give him 3-4 days. I usually rebook 4 or 5 days or 3 days. If person in pain, I'm going to say, okay, David, so I think we did really good work, you feel beneficial for like that therapy was beneficial, I will probably suggest you come back maybe in 3 4 days. Are you available at this time?
Yes.
Great. If the David say no, I'm not available, I'm going to be tripped. Okay, David, so what about next week? You have to put him down. And if persons I don't know, you're still gonna book whatever you use. You'll use your phone for booking. You use your Google Calendar. If you even if you use that the diary, the writings part, this away. It's not gonna work. People never gonna come back. I mean, they not remember. You don't sell any text messages to them. It's the new technology. I mean, it's beat that stuff, you know. Just maybe for yourself, write down somewhere, but have to be in your Google Calendar. It have to be in a booking system. It's already there. So many AI who can book for you, so it's not a problem. My idea is that David come back in 3 4 days, maybe next week. Don't wait more than a week because if he wait, he might never come back. So you book him. You got his payment information. Never make this mistake and always make him prepay half. If the person cancel 24 hours, you return that money. But if person cancel 3 4 hours, a lot of percentage, people maybe forgot, send them text message, but always 50% prepaid before your treatment. David, I explain everything. I say goodbye to David. I give him my information. I give him my business card. It's on my phone. I use QR code. You can see on the screen right now. David can scan it. I'm already in his phone. It's a nice, like a business card. I show you next time how to build this in 10 minutes and get your own business card. I explained to him, come back. I put the soap notes. I want to put the soap notes. I'm explaining why. Because if David come back and he get that left side pain, but David come back in 4 days, I say, okay, how's that right side is doing? How David is going to feel about this? Not good, right? But if he's come back, I check my soap notes. Okay, so how that left side? Can you go ahead and turn for me one more time? So this is the second time he's come back. I did the same thing what I did before. I just do not explain them who I am and what I'm doing. So because I'm already did in the first session. Now it's all about the David. So David, tell me, how do you feel today?
It feels good now.
It's feel better?
Yeah, it feels better. Much better.
I still do a postural assessment. I still do functioning assessment all the time. All the time I'm doing this. I want to see result. I just don't want to poke people and, you know, how am I going to call that? Just, I don't want to be masseuse. I want to be I want to be a therapist who can help person. That's who I am. So, and if you guys watch this video, I hope you want the same. So next one, I did the same. We do assessment. He go on the floor, on the table. He get up. I explain. I left. I'm bringing water. And now this is the time to do our package time. And your package, whatever you sell, package or membership or subscriptions. So if I like David and he's come back monthly or weekly or every other week, you get them package. So David, I think it's really beneficial for you. And what do you think to work in the future for me once or twice a month? Come back for the
I
therapy?
can do at least once a month.
Once a month. Yeah, of course. It depends on your financial situation. I'm not like pushing people. Like I said, you just look around. If you go house calls, what kind of house, what kind of person is that? If trust me, some people can afford it. Some people just afford every other day. I have clients who get massaged 4 times a week. So yeah. Okay, David, if you once a month, I have that packages because my prices it's 157 and I have a subscription program. What's the benefits for you? It's a $20 discount and I'm guarantee I'm going to work in on you once a month. So I'm going to be you my subscribers and I'm up only subscribe 50 people. So if you would like to continue work with me, I have this package. Inside the package, I usually put some vouchers, coupons. We're going to talk about this. I put my my review, it's gonna be like a flyer with when people can scan the code, and it's go to the review, Google review, Yelp review. Next one they're going to open and they're going to scan that code or read that. It's going to be to my channel, in my channel, where I can tell them like stretches, show them like home exercise, because I don't want to show individual person all the time. I might show one, two, but my channel, it's showing like full class for those stretches, exercise, what they can do. And I'm, like I said, in my channel, I can focus on the neck, I can focus on the lower back exercise. Next one, I give him like a little, like a membership congratulation, like a certificate, to see that like right in here, so you can see it. I will put the name, and it's from me for Life RX. I take care of him. It's like, I saw those plumbers or electricians, they complete the job at the house. They always ask the owner put those little sideboard, and it's sideboard says protected, check-in and protected by plumber, and the company name and the phone number and a QR code. Guess what? People driving, they see the neighbor have those board, they scan it, and here we go. This is how you get. Next one, like I said, so certificate, idea about your company, how to connect to your company, the phone number, everything inside, the channel. Next one, I want give him a lot of cool stuff, and especially I can do like a extra, maybe some free copying for David. Why not? Or I can do CBD, and I always tell him, so you can might have a copying if you would like, because I would like to keep those people and don't let him go. I give him like 30 minutes free massage. Maybe I'm add something one day. I have a 20% discount for his family, for his friend. So he just only puts his friend name and his name and pass to people. I appreciate it. So it's a referral program. We call this Triple R, rebook review referral. So he's already signed up. I give another one, so many, as much as possible. I give him $50, which is a referral. If he referred a friend, David can make $50. Guess what? He bring me more and more customers. I don't need to spend on Google advertising. I don't need to spend all those stuff. It's already here. All right. And that's the key. The more your subscribers you have, or membership or packages, the more you're going to be booked, the more you're going to be organize your time. Because like I said, you don't know who's going to come, who's not going to come. And plus the subscribers program, it's only like $15. They pay $15. And if you have 50 subscribers, multiply $15 or $17, this is what you got. They save this money on each massage because you give them $20 discount, and it's a good deal. They like, wow, it's just so great. Great, because you get customers. Every month you get those 50 customers, and you build that number, like whatever your number is. My is 50. I don't want to do more than 50 massages a month. So even maybe 40 now. That's the idea. When I start, I probably do like 100, 120 massages a month, and that's, trust me, not good. You feel exhausted, you feel tired, because it's very, very physical work. Okay? This is how you sell the membership. If people don't want to buy it, if you don't like the person, if I don't like David, I don't know, for some reason, I will probably never show it to him. I want him to come back and pay me full price. But if he asks me about membership, maybe he find out this information on my website or on my videos, yes, of course, I have to apply it. Okay? If, like I said, people not buying your package is because, or membership is because you didn't prove enough it's good for them. You don't do all those step by step, and that's a mistake. So don't make those mistakes. Follow those steps, and trust me, you will sell those packages. And yeah, create this nice. It's like a $5. You can folder. You can go call designer, or even AI can design the package for you. Not the package, the folders. You see, it's nice. Phone numbers, information. So it's all cool. All right. I hope this video is going to be helpful for you guys. Sell those packages, subscribers, membership, and make good money. Financial support. Thank you.